My name is Krista Stewart. I'm in the Office of HIV/AIDS at USAID.
And on USAID's evaluation policy, what is the intended outcome of implementing this new policy?
So the new evaluation policy has basically two focuses. One of them is to be able to be more accountable for what we're implementing, making sure that the activities are being implemented the way they were intended to be implemented. So on one level it's accountability, but also through the evaluations that are done, we want to also increase our learning about what works and what doesn't work. Basically, there will be two types of evaluation. One to look at performance, and that would be more related to the accountability aspect. And the other part is to look at impact, and that would be more related to the learning part of the evaluation policy.
And how will measure evaluation be able to address these two areas?
Well, one of the ways that I think that measure evaluation could be particularly helpful is in giving people technical advice and technical support in setting up impact evaluations. Impact evaluations are ideally designed before the implementation of an activity. A measure evaluation could assist in the very early stages in actually designing an impact evaluation where baseline data could be collected at the beginning of a project and then plan for how data will also be collected at the end of the project to assess the impact.
And what have you seen or observed that measure evaluation has done to impact the field of global health and population health and nutrition?
I've actually worked with the predecessor of measure evaluation, the evaluation project, in the very early years, and have at least some association with the project until actually returning to the project as AOTR 2 years ago. And when we first started, the capacity for any kind of monitoring and evaluation, this is like over 20 years ago, was extremely limited. And there were no handbooks of indicators, there were very few trained M&E people. But over the last 20 years, the changes have been pretty remarkable. We still have a lot of work to do, I think, in terms of helping governments move toward their own M&E systems in the countries. There still is a lot of work to be done on data use. And I think also on a higher level evaluation capacity, particularly doing impact evaluation.
Great. Well, thank you so much for your time.
Sure.